So good morning to all. Uh, Let us see sodium potassium chloride. This is a small chapter and brief introduction of electrolytes. Means it include under mineral. Okay, this is the last three mineral. So as I already told, in your syllabus it is only brief introduction is there, so some of the slides may be little bit more, so no need to worry. At the end of the this mineral I am giving the questions. For the exam purpose we can go through those questions only thoroughly. Some of the introduction part may be little bit more, okay, more than one examples, all those things, so no need to worry. Okay, so you should know mainly minerals sodium potassium chloride as a part of electrolytes. Okay, sodium, you know that it is a table, comes under table salt, so it is mainly required to maintain the blood pressure. Okay, so as a electrolytes, and there is a lot of function is there. We will see one by one these macro minerals, so they required in milligrams, so they are macro minerals. Okay, so they are macro minerals. So sodium is the chief electrolyte. It is found large concentration in extracellular fluid. ECF means extracellular fluid. So which is found in large in intracellular fluid, that is potassium. Okay, so total body content of sodium is about 1.8 gram per kg, approximately 50% in bone, 40% in ECF, 10% in tissue. Sodium is found in the body mainly in association with chloride, sodium chloride. Table salt is, as I told, sodium chloride, NaCl, is used in cooking, food processing. Also it is a dietary source of sodium. Okay, so sodium, that is a table salt, as I told, it's a table salt. So salty food, animal food, milk, egg, cereals, carrot, even seafood also contains sodium. Okay, table salt we consume anyway day to day life, in okay, each and every food, for the taste purpose we have to add sodium chloride. Okay, RD is 5 gram per day. Absorption, excretion in brief: absorption from GIT, gastrointestinal tract. Okay, gastrointestinal tract. Sodium potassium pump, less than 2% normally found in feces and sweat. So remember that in the sweat also sodium is excreted. Okay, in the urine also sodium is excreted, feces. In diarrhea large quantity of sodium is lost. That is the reason why oral rehydrating agent, ORS, or table salt with lime and all given during diarrhea, because sodium is lost. More and more sodium lost means it affects the kidney and blood pressure, it drops the blood pressure. So sodium is very important. Okay, so sodium, what are the functions in brief? Sodium is essential for maintaining osmotic pressure and water balance. Okay, it constitute buffer and involved in maintaining acid base balance, because sodium chloride is required for acid base balance. Okay, it maintains the irritability and cell permeability. It is required for the movement of the molecules. It's involved in the intestinal absorption of glucose, galactose and amino acid, means in the form of transporter, GLUT. Okay, glucose transporter and all, it is required. Okay, in that way it is required. Okay, it's necessary for initiating and maintaining heart beat. So that sodium ions play an important role in originating and maintaining this heartbeat. Okay, so normal sodium is 135 to 145 milli equivalent per liter. Okay, so no need to go details, great details. So that's why I told in the brief you have to study. So you should know what is sodium, what is the source, what is the normal range, and what are the disorders of sodium metabolism. Hyponatremia, this you may get as 3 marks short or 5 marks short note. Okay, decrease in the sodium level less than 130 milli equivalent per liter is called hyponatremia. Anything hypo means below the level, low. So what is the normal range for sodium? 135 to 145 milli equivalent per liter. Okay, so if it is less than 130 milli equivalent per liter in the blood sodium, then it is hyponatremia. So it usually causes during vomiting and diarrhea, Addison's disease, that is adrenal insufficiency. Okay, aldosterone secretion is reduced here, Addison's disease. So that is Addison's disease is adrenocortical insufficiency. Renal tubular acidosis, reabsorption is defective. Okay, so more and more sodium is excreted in the urine. Okay, reabsorption defect is there, more and more sodium is excreted in the urine. So renal tubular acidosis, chronic renal failure and nephrotic syndrome also sodium level is low. Chronic kidney disease or renal failure and nephrotic syndrome also because of the nephrotic syndrome because of the imbalance. Okay, in congestive heart failure also sodium level is low. Okay, you know that sodium is required for an important role in originating and maintaining heartbeat. Okay, so in edema also there is hyponatremia. Okay, decreased sodium level. So osmotic pressure, maintenance of osmotic pressure, there is imbalance in maintaining osmotic pressure. So in edema also hyponatremia, that is sodium level less than 130 is there. Okay, so what are the symptoms of hyponatremia? Drop in the blood pressure. Okay, that is the main symptoms. Lethargy and confusion, tremors and coma, that is later stage. So hyponatremia due to water retention, this is another type. Retention of water dilutes the constituents of extracellular space causing hyponatremia. Okay, there are different reasons in the retention of water. So example, heart failure, liver diseases, nephrotic syndrome, renal failure and all. Okay, and also in increased ADH secretion. ADH means antidiuretic hormone. Retention of increased ADH secretion. Okay, increased ADH secretion. Okay, so there is water retention is there. So this last one need not required, but you have to remember what is the cause of hyponatremia. Hyponatremia. Okay, symptoms hyponatremia, cause, then symptoms you should know. Okay, and treatment in brief. Administration of sodium should be administered sodium should be closely monitored. We have to give sodium after sufficient time for distribution, 4 to 6 hours. Water restriction is required. Increased salt intake. So you can write just increased salt intake and anti ADH, anti-ADH means antidiuretic drugs. Okay, because this ADH is involved in water balance. Okay, so sodium loss is usually occurs by vomiting and diarrhea. So urinary loss may be due to aldosterone deficiency, that is Addison's disease. Aldosterone is mainly for this one blood pressure maintenance. It is required. This Addison disease, urinary loss of sodium is significant. Okay. So hypernatremia, sodium level is above 145, we can consider as hypernatremia. Cushing's disease, hyperactivity of adrenal cortex. Okay. In pregnancy, steroid hormones cause sodium retention in the body. In dehydration, water is predominantly lost, blood volume is decreased with increased concentration of sodium, that is relative change. In dehydration, predominant loss, blood volume is decreased, so increase the concentration of sodium, so hypernatremia because of the dehydration. In pregnancy, because of the steroid hormones, and Cushing's syndrome's disease also, that is hyperactivity of adrenal cortex. Okay, it secretes hormones. Okay, so there is a increased serum sodium concentration. So symptoms of hypernatremia: increase in the blood volume and blood pressure, dry mucous membrane, fever, thirst, restlessness. These are the symptoms of hypernatremia, increased sodium level in the blood. Okay, so next is potassium. This slide is for potassium. Potassium is the major intracellular cation. Sodium is the major extracellular cation. Potassium is the major intracellular cation. That is the reason why if you collect the blood, see during biochemical analysis, we will collect the blood, wait for sometimes 15-20 minutes until it clots, then we separate the serum. Okay, clear fluid, and that serum is used for biochemical investigation. But if serum is hemolyzed because of some contamination or vigorous mixing, etc., serum is otherwise yellow clear fluid. Serum turns reddish pale red color. This because of lysis of RBC. When RBC lyses, this potassium level also comes higher, because potassium is the intracellular cation. When red blood cells get lysed RBC, this potassium comes out. Okay, so in hemolyzed blood, potassium concentration is more. About 98% of potassium is in the cell, only 2% in the extracellular fluid. So total body potassium in adult male is about 50 milliequivalent per kg of body weight, as most of the body potassium is found in muscle. Okay, so what are the source of potassium? Vegetable, fruit, whole grain, meat, milk, legumes, and tender coconut water. See, if you are taking fruits like especially banana, and in our day-to-day life, banana, if you are taking, it is rich in potassium. Also remember, tender coconut also rich in potassium. Okay, other as usual, many of the foods it is there. Fruit, especially banana, is rich. Tender coconut contains electrolytes. Potassium also it is rich. RD is 2 to 5 gram per day. Okay, in brief about absorption, potassium is readily absorbed by positive diffusion from GIT. Okay, passive diffusion from intestinal tract. Passive diffusion means is a type of movement from the region of higher concentration to the region of lower concentration. No energy is required. It's passive diffusion. Okay, The amount of potassium in the body depends on the balance between potassium intake and potassium output. Under the normal condition, loss of potassium through GIT and skin is very small. The major means of potassium excretion is by the kidney. Potassium output occurs through the primary routes, GIT, skin, and the urine. Okay, you should know in brief these things. What are the functions of potassium? So functions of the potassium may be studied in physiology. For depolarization and contraction of heart required potassium. That is the reason decreased potassium is risk hypokalemia, we call. Okay, less than 3 is hypokalemia is risk. The depolarization and contraction of heart requires potassium. During transmission of nerve impulse, there is sodium influx and potassium efflux. Okay, with the depolarization. After the nerve transmission, the changes are reversed. Okay, so altogether you can just write in brief. For the contraction of heart, potassium is required. The intercellular concentration gradient is maintained by sodium potassium ATPase pump. Okay. The relative concentration of intracellular and extracellular potassium determine the cellular membrane potential. Okay, these are related to physiology. Okay, so potassium is required for the contraction of heart, and during nerve transmission there is sodium transmission of nerve impulses of there is sodium influx and potassium efflux with depolarization. Okay, so next potassium influences muscular activity. Certain enzymes such as pyruvate kinase requires potassium as cofactor. Potassium is involved in neuromuscular irritability and nerve conduction process. Potassium is required for proper biosynthesis of protein by ribosomes. Okay, these are some of the field where there is a need of potassium ion. Okay, so normal serum potassium level is 3.5 to 5. Okay, so milliequivalent per liter. This is the normal range for potassium. So what are the disorders of potassium metabolism? Hypokalemia is potassium is 3.5 to 5 milliequivalent. So when it is less than 3 millimoles per liter below, it is called hypokalemia. Hypokalemia is a clinical condition associated with low potassium concentration. Hyponatremia means sodium low. Hypokalemia means potassium level is below 3. So in causes, there are 4 types. Increased renal excretion, that is the one cause. Increased renal excretion. Cushing syndrome, and that hyperaldosteronism, hyperrenism, renal artery stenosis, hypomagnesemia, increase in the magnesium concentration, renal tubular acidosis, adrenogenital syndrome. So you remember at least one Cushing syndrome. Okay, enough. Then second cause of hypokalemia is shift or redistribution of potassium because of alkalosis, insulin therapy. Potassium insulin therapy mainly in diabetic patient, IDDM patient. This happens. Then thyrotoxic periodic paralysis, hypokalemic periodic paralysis, abnormal calcium channel and all. You can just remember shift or redistribution of potassium, either alkalosis or and insulin therapy. Okay, third is gastrointestinal vomiting loss, that is because GIT, mainly diarrhea, vomiting, aspiration, deficient intake or low potassium diet, malabsorption, pyloric obstruction, these and all disturb in potassium absorption. IV saline infusion in excess, okay, that is there. Fifth one is IV saline infusion in excess. So the saline that will also cause hypokalemia. Saline infusion means it contains only sodium and chloride, so potassium level is lost. Saline means sodium chloride, okay. So fifth one, drug like insulin, IDDM patients, insulin dependent patient, okay. Salbutamide, mainly treatment for your asthma and all. Osmotic diuretics, increase the urine volume. Corticosteroids, steroids they can alter so many things, even blood pressure and all, blood sugar and all. Corticosteroids, okay. So these are the things comes under hypokalemia. If asked, we can write brief. Hypokalemia is a clinical condition associated with low potassium level below 3 millimoles per liter. Then cause you can write, okay, in brief, one or two example enough. Hyperkalemia above 5.5 millimoles, okay, elevated plasma potassium. So causes decreased renal excretion of potassium, maybe because of the obstruction of urinary tract, renal failure. When there is decreased renal excretion, potassium comes to blood, so serum potassium level increases. Deficient aldosterone, Addison's disease, okay. So and severe volume depletion because of the heart failure. Then there are the pseudo hyperkalemia, because pseudo means wrong, false hyperkalemia, that is factitious. Potassium leaches out when blood is kept for a long time before separation, okay. This mainly problem comes under blood transfusion in blood bank. Improper blood collection, the hemolysis will be there. Hemolysis means breakdown of RBC, so that see, you know that potassium is mainly intracellular element, that is it is present inside the cell. So when RBC lyses, this potassium comes out, okay. So improper blood collection means too much improper or mixing, whatever, if it is mixed with the methanol, whatever, so RBC lyses, so potassium level will be high. Thrombocytosis, thrombocyte means platelet, if it is higher than 400 millions per ml. Leukocytosis means increased WBC count, white blood cell count, above 11 millions per ml, okay. So third one is hyperkalemia, redistribution of potassium to extracellular fluid, mainly metabolic acidosis, diabetic ketoacidosis is the example. Insulin deficiency, mainly diabetic mellitus. Tissue hypoxia, means studied in physiology, maybe reduced blood oxygen supply to the tissue. Tissue become deficient in oxygen. Hyperkalemic, this one, next one, hyperkalemic periodic paralysis, that is one of the cause. Then drugs, spironolactone, beta blockers, cyclosporin, digoxin, these are the scheduled drugs, okay. They also cause hypokalemia. At least one or two remember, that is enough. So next is chlorine. Sodium potassium is over. Chlorine is the major anion in the extracellular compartment. So which one is the intracellular? Only potassium. Okay, in the adult body, chloride is about 30 milliequivalent per kg body weight. Approximately 88% of chloride is present in extracellular fluid. Okay, 12% in ICF. Approximate this is. So sodium and chloride is always associated. Sodium chloride, nothing but table salt. Even leafy vegetable, egg, milk, and even food preservatives contain sodium and chloride. RDA is 2.5 gram per day. Okay, functions in sodium chloride is essential for water balance, regulation of osmotic pressure, and acid base balance. Chloride is necessary for the formation of HCl by the gastric mucosa and the activation of enzyme amylase. This is important. Chloride is necessary for the formation of hydrochloric acid. See, you know that gastric juice contains hydrochloric acid. So chloride serves as a ion for H to form HCl. So chloride is necessary for the formation of hydrochloric acid by the gastric mucosa and the activation of enzyme amylase. So HCl has many functions, okay, in the gastric juice. So chloride also involved in chloride shift. Okay, this studied, I think, renal physiology. Okay, so I am not going to detail this. So given the brief explanation. So absorption and excretion rapidly and almost totally absorbed in the GIT. Under normal condition, chloride excretion occurs in three ways: GIT, skin, and urinary tract. Chloride is excreted mostly as sodium chloride and chiefly by the kidney. And about 2% is eliminated by the feces. So normal level of plasma chloride is 95 to 105 milliequivalent per liter. Okay. So disorders of chloride metabolism: hypochloremia. It is caused by GIT and renal loss of chloride. GIT loss occurs by vomiting and because of the loss of bicarbonate. Renal loss occurs by Addison's disease and salt losing nephropathy. So these are some of the conditions where there is hypochloremia. Okay, you can just read these things enough in brief. Hyperchloremia, increased serum chloride, mainly dehydration because blood volume is reduced. Cushing's syndrome, hyperaldosteronism. Okay, and increased aldosterone secretion, severe dehydration, loss of bicarbonate, respiratory acidosis. There is increased serum chloride level. Okay, so these are in brief about sodium, potassium, and chloride. So anyway, I am sending the notes in that group because some of the slides are looks a little smaller the font. I am sending the slides anyway. Okay, thank you.